Welcome to the Huntington's Queensland Community Forum. I am so delighted to be here, but as you know, I would really prefer to be with you there today, and I will come back as soon as I can. So today what I'm going to talk about is, first I'm going to just give an introduction to what is Huntington's disease. Many of you know, but there might be new people in the crowd, and usually there's something for somebody to learn, even if they've known about the disease for a long time. After that, I'm going to talk about updating. I'm going to update the group around what's going on with finding treatments for Huntington's disease. And then I'm going to talk about what's new for Australia, something I'm really excited about because I'm going to be announcing to you about a map, a Huntington's disease registry for Australia that is just about ready to launch. So without further ado, I'll get started. So I think probably everyone knows that life starts normally for people who are born with the Huntington's disease gene expansion. Mostly people show no signs of HD in childhood. There is a rare juvenile form of the disease, meaning that the disease can actually start before a person turns 21, even in childhood, but it's very rare. So usually there are no signs in childhood. But as the child grows up, and usually when they're a teen or a young adult, maybe their parent begins to show some signs of Huntington's disease. And young people tend to know something about Huntington's disease because maybe a grandparent has had it or someone else in the family, aunts, uncles, cousins, and that sort of thing. Now, just to kind of, settle on looking at kind of what the experience of Huntington's disease is like. First of all, I want to say that Huntington's disease is a unique experience for every single person who has it and for every family. And every family has its story. Every family has its differences, and every person with Huntington's disease experiences it somewhat differently. But as a scientist and a researcher, one of the things that happens with us is that, and a clinician, is that people come to us and we learn from what people tell us about their experience. And so I want to tell you about, this is a fictitious person, that this is not a real person of a real picture of an HD family, but it's just an example I like to use to kind of get started, and it kind of links to many people's experience, so that's why I use it. So James came to us in our clinic, and he told us that at work he was having trouble getting his projects done on time. He had started worrying that he might be about ready to get fired. And what we thought about that is that he was starting to have a bit of slowing in his thinking. Some of his movement might have been slow, but in particular, we were concerned because he was starting to feel a bit of anxiety about Huntington's disease. He said to us that sometimes he works on the same part of a drawing he's doing. He's working in a city council office. He's finding himself doing things over and over again and taking too long. And sometimes what this is related to is people with Huntington's disease sometimes get a bit stuck on certain things. They have trouble shifting from one thing to another and maybe take a bit more of an obsessive approach to things. Not everybody, but this is something that can happen. He also told us that if he got a call in the middle of something he was doing, he would forget what he had been doing, and he would have a hard time getting back to it again. And this is really a sign of distractibility. And then he told us that he had started kind of forgetting things. He had missed a team meeting, and someone had come to his office after the meeting was over and told him that he had missed the meeting. He said he just spaced out and he never thought about it again. So this is a sign of losing track of time, memory difficulty, and things like that. So this is a person really pretty much functioning normally, but just noticing some minor changes in what they're able to do. And in Huntington's disease, as I said, people start out functioning, completely normally. And at some point in adulthood, they have a few changes, and these changes are really minor. They usually last for several years, where they begin to think maybe something's not quite right. But eventually, that can turn into the diagnosis of Huntington's disease. So what are the characteristics of HD? There are changes in people's movements. There are changes in their thinking and memory, and there are changes in their mood and emotion. And these are all things that are important to know about, and I know that some of the talks today will be covering some of these things. I'm not going to go into them in great detail, but the way we think about these symptoms of Huntington's disease is that these are people's experiences with what they're finding and what they're observing, what people are observing in them, like their family members can notice these things as well. And for many years, while people are having really minor symptoms, things are functioning normally, things are going fine for them. They're functioning okay at work, they're functioning okay at home. But eventually, as these things progress, and it might be the movements, it might be the thinking, or it might be the mood issues, eventually as those things progress, it does begin to have an effect on people's day-to-day life. And once that happens, that's usually when we start calling it Huntington's disease. Because in the time before that, we just think of these as just symptoms that are beginning to arise, but it's not until people really have trouble with their everyday function that we actually diagnose it as Huntington's disease. And that's kind of an important thing to remember. So if somebody gets the gene test and they find out they have the gene for Huntington's disease, it doesn't mean they have the diagnosis yet. It just means they have the gene, and that those symptoms will develop in time. Now, Huntington's disease is a genetic disease, as I've mentioned, and the gene for Huntington's disease was actually discovered in 1993. And this is a picture of Nancy Wexler in Venezuela. Now, Venezuela, this area called Lake Maracaibo, is a really important place for people with Huntington's disease because it's where the Huntington's disease gene was identified. So Nancy Wexler is a psychologist. She's actually has Huntington's disease, and she's probably close to 80 years old now, still alive, living in New York City in an apartment. And her mother had Huntington's disease, and she and her sister got very involved in trying to find out and understand the gene, how the gene is passed through families, and to try and get involved in treatments. And so in the late 1980s, she started taking a group of people down to Lake Maracaibo in Venezuela to learn about that community, because that community had a really high rate, and still does have a very high rate, of Huntington's disease. So they went down there and they mapped the families there who had the gene, or who had the disease and who didn't, because at that point we didn't know where the gene was in the chromosome, and we didn't know how it was really passed down. But by these painstaking mapping on paper in these rooms where they pasted up, the family trees, they figured out the first information that was needed to understand where the gene in Huntington's disease, the gene for Huntington's disease, was located on the chromosomes. And there was kind of an earlier stage of that, but finally in 1993, on the basis of this work by Nancy Wexler and her team, the gene specifically was identified as a gene that's on chromosome 4, and it's known to be an autosomal dominant gene, which means that when a person inherits that gene, they will eventually develop Huntington's disease. Now, this is just a little bit about how the transmission of the disease works across generations. So this is a typical family tree. It's just like what you saw in that diagram with Nancy Wexler. And it shows, this is just how geneticists do it. They show females are circles and males are squares. And in this case, what we have is that the dark color is a person who has the HD gene. So in this case, it's just showing a series of generations: parents, their children, then the grandchildren of those parents, and then these parents' great-grandchildren. And so this is just looking at a typical transmission of the disease across the generations. I've just got to put up my laser pointer so you can see what I'm pointing to. Okay, so in this case, what we have is a couple of parents. The mom over here, she doesn't have the HD gene. The father does have the HD gene. And then they have 1, 2, 3 children. One daughter who inherits the HD gene, one son who inherits the HD gene, and a third child who's a son who does not inherit the HD gene. And then if you trace these families, so this daughter has a partner, this male in this case, and they have 2 children. And because she has the HD gene, each of her children has a 50-50 chance of inheriting that gene. And in this case, one child, a male, got the gene and will get Huntington's disease, and a female didn't get the gene and will never will never have Huntington's disease. In this family, you have the son who has the gene for HD, the daughter who has a partner who doesn't have the HD gene. They have 2 children, and it shows here a 50-50 with a 50-50 chance. One child gets the HD gene, it's a girl. The other child, a boy, does not. And in this next generation, what they show is there's 3 children, and in this case, 3 of those 4 children actually inherit the HD gene and 1 does not. But actually, you know, it's possible none of these people would have inherited the HD gene, or just 1, or even all 4. And that's because each individual person who's descended from a person with Huntington's disease, each of them has a 50-50 chance of inheriting the gene. That means, you know, just by chance, a whole set of children, siblings may not have it, they may all have it, or just some will have it. But on average, it's about 50%. And over here, you can see this is a generation that's not going to, this is a generation that's not going to have Huntington's disease because the parent didn't get HD, even though that parent was descended from a person with Huntington's disease. So that's a little bit about the family tree and how that works. Now, just a little bit about how we think of the progression of HD, because actually, right at the time of conception, when the egg and the sperm come together, the HD gene is present there, right from that starting point. But it doesn't really manifest itself usually until well into adulthood. This is a diagram that scientists have laid out. This is a brand new diagram that is a new way of kind of classifying Huntington's disease that's going to be used not so much in the clinic, but for research to help with finding the treatments that we're all looking for right now. So what this shows is that a stage called stage 0, which is basically when the DNA with the HD gene expansion is present, but it's just the DNA there, and there's nothing pathological going on, no brain changes, no changes in the body. The next stage, called stage 1, is a stage where people are still completely asymptomatic. They don't have any movement differences, any changes in their thinking, no changes in their mood, aside from what we all have every day. But in those people at stage 1, actually, if you do brain imaging studies and blood studies, sometimes you can find tiny little indications that there are some differences that are beginning to emerge. And this usually lasts for, a couple of decades of a person's life. So this means that a person's not, they're not called diagnosed with Huntington's disease. It just means that there are things happening biologically. And why this is so important is because if we know that this is the stage at which biological changes are beginning to happen, this is when we want to be able to start treating the disease so that those biological changes never progress into clinical symptoms. So this is called stage 1, the biological changes begin. This is called stage 2, and this is when a person begins to notice that they're having some signs and symptoms. They might go and see their doctor and get some tests and see whether they're beginning to show the signs and symptoms of Huntington's disease. But at this point, a person is fully functional, still working in their job, still doing all their roles in the family, and not really, maybe slowing down a little bit, but maybe not really having any difficulty with the disease itself, just having some mild changes that they might notice. And then after some years, maybe 10 years or 15 years, it's hard to say, it varies for different people. Eventually what happens is those changes turn into what we call clinically significant changes. In other words, they affect a person's everyday function. That means that it might mean that they have to change their work, or maybe even they stop working eventually. Maybe they change their roles at home and they need more assistance. So this is kind of thought of as, a kind of way of thinking about the progression of HD, because the gene is there from the beginning, all the way here at stage 0. You've got some biological changes here, but nothing noticeable for the person. Then a person begins to notice some changes eventually, and eventually those changes affect their ability to do their work and their home roles and things like that, and gradually they need some help and more help across time. So that's a new system called the HD Integrated Staging System. And what's important about that is that right now we tend to diagnose Huntington's disease right about here. And typically when we do clinical trials, we're starting to test people, or we're starting to give people test treatments right about here. But what we're thinking about is how can we move the testing of treatments back to this stage when the biological changes are just beginning, because that way that we're going to have a much better chance of trying to either delay or prevent the beginning of these clinical signs and symptoms. And those are the things that people experience. And so if we can avoid having those, that's really the ideal. Okay, so now just in terms of this presentation, I'm talking first about what is Huntington's disease. Now I'm going to talk a little bit about the updates on finding treatments, and then we're going to talk about what's new for Australia. So people might remember, and you might have seen this in the Huntington's Queensland newsletter, heard about it from friends and from the state association workers at Huntington's Queensland. But in March of 2021, we had a very disappointing couple of weeks, because there were 3 clinical trials for Huntington's disease treatments. They were being trialed all over the world, but also we had these trials running here in Australia. We had the Roche trial, which was running in Melbourne and Sydney. It was called Generation HD1. We had 2 trials from this company called Wave Life Science. They were called Precision HD1 and Precision HD2. And probably some people who are in this audience may have been in Precision HD1 or Precision HD2, because Brisbane was a clinical trial site for that. Again, it was an international trial. And what happens with these international trials is that these drug companies work with doctors all over the world to try and test these treatments with the patients that they have. And you have in these cases, there were specific criteria that you had to meet, specific requirements that you had to meet to be able to be in these studies that were kind of hard to get into. But eventually, HD1 and HD2 in Brisbane, as well as in other parts of Australia. But we got the news first in March. We got the news that the Roche trial had failed. There had been an interim analysis. They actually looked at the data even though the trial wasn't done. There's a way you can do that with clinical trials. And when they looked at the data, they realized the trial wasn't working. And so they stopped it. They didn't have any concerns about the safety of the trial, but they found that, they really, in a way, decided that they didn't think that they had properly tested the drug, and the trial wasn't going to work, so they stopped it. And there were 680 people in that trial all across the world. In Australia, there was only a handful. The Wave Life Sciences company announced 1 week later, so we were all reeling with this disappointing news because we were very hopeful about these treatments. But a week later, Wave announced that neither of their trials were working either. And all of these trials were brought to a close over the next short period after that. So this was really a downer. I'm telling you, the international community, both scientists and the doctors, but also the families with HD, really had to bear a huge brunt of disappointment in March this year. But I'm here to tell you that there's still a lot more going on, and we have new trials that are going on as well. So let me tell you about that. This is just a list of some of the companies that are doing trials right now, and several of these trials are going on already, but some of them are just getting ready to start. This company is called Unicure. It's doing a trial where it's actually injecting brain cells into some of the parts of the brain that are affected in Huntington's disease to try and grow new brain cells there, or not to try and grow new brain cells there, I'm sorry, to way the DNA is being produced there to try and create a treatment. And there's another company in the US that's also getting ready to do another trial like this. This is a company called Prolenia. They're testing an old drug that's known to be very safe, and it has some early evidence that it might be effective, and they're doing a big trial, a big multi-site trial internationally. Australia is not involved in either of these two. This is another company called Triplet Therapeutics. They're just getting ready to start a trial. Wave Life Sciences, who I just mentioned in the last slide, they had these 2 trials that failed earlier this year, but they have another trial that is of an improved version of the approach that they were taking in the previous trials that they're very optimistic about. And they are, they've just gotten started on that. They've had the first 4 people dosed in that trial, and that trial is going to be running here in Australia. It's very hard to get into. There's actually, besides having the HD gene, there's another genetic thing you have to have. But we've found a couple people so far in Australia who have that and who are going to be offered the opportunity to participate in this trial if they want to. PTC Therapeutics is also going to be running here in Australia. They've just, in fact, I think next week or the week after, they'll be dosing their first patient here. And then Sage Therapeutics, and this is a trial I think might be particularly interesting to people. This is a way of trying to improve cognition in people who have Huntington's disease. And this trial is going to be running in Australia, and I'm very hopeful that this trial is going to actually come to Brisbane. So I would say, watch this space and see whether that might be happening. It'll probably be in the first half of the new year, if not a little bit earlier. It won't be this year, but it will be sometime probably next year. So we're working hard here in Australia because what we want to do is we want to create the opportunity for people who would like to be part of these treatment trials to be part of those. And so as much as possible, we're working toward, as many sites around Australia where there's expert doctors and where there are people who have Huntington's disease who desire to be in these trials. Not everybody wants to do it, and some people really want to do it very badly. So we're trying to make that an option that's available to people. Now, there is a lot going on to try and find treatments for Huntington's disease. And so one of the questions that I and others across Australia have been asking is, in Australia, if a treatment does get approved, if a treatment gets approved internationally because it looks like it's effective, are we ready to approve that treatment in Australia? The Therapeutic Goods Administration has to approve it. Are we ready to have that treatment paid for? Because I can tell you these are looking like they'll be relatively expensive treatments. So how are they going to be paid for? And then the third question is, how are we going to deliver these new treatments to people with HD when they're ready? Okay, and I think this is a question that we've been asking here in Australia, and the answer is we're not really quite ready yet. So as much as we're trying to participate in the clinical trials to get these drugs approved, if they got approved, we are not in a position to bring them as quickly as possible to people who have Huntington's disease. And I'm going to talk a little bit about that now, and this is really the last part of the talk. So the way to think about this is that, in Australia, we have an ecosystem. We have the community of people. I've got to get my cursor back here again. We have the community of people, and you're the community. We're really all the community, but the HD community is made up of people who are in HD families, people who have the HD gene themselves, and people who don't, but also people who have Huntington's disease itself. So the ecosystem in Australia is the community of people with HD. It is the state associations that are, like Huntington's Queensland. There's an association for all of the states, and all the states and territories are covered. You have the clinical services and the support services, like these are the services that, like Dr. Rob Adam and others in Brisbane are providing. There are services that are provided across all of the states. You also have the groups that provide support through NDIS. These are all the services, and that's part of this group that we're all in. You have researchers. These are people like me, and there's quite a few people across Australia. I think you'll probably hear from some other ones today who are working on Huntington's disease scientifically. And then you have government entities, and the government entities are for example, the Australian government, which provides us services through Medicare for our medical care, and it provides us with the benefits to reduce the cost of drug treatments, like through the PBS. So when you go to the drugstore and you get your kind of cost-reduced drugs, that's because the federal government is providing a subsidy. So this is the community, this is the ecosystem that has to work together to be able to get treatments approved and paid for and then out to the community. And so this is really important, is that we have to all work together. So, and when a company finds a drug that's effective, what they have to do is they have to actually go country to country, and I've written it over here, companies must make a case to the government that's based on the current extent of that disease, okay? So let's say a drug got approved, let's say one of these wave drugs gets approved, then the wave company has to come to Australia and they have to apply to the government to get that drug approved by the Therapeutic Goods Administration. Then they make an application to the Pharmaceutical Benefits, it's called the PBAC, the Pharmaceutical Benefits Advisory Committee, to try and get that drug paid for. And how do they do that? Well, what they do is they have to say, well, in Australia, there's X number of people who have HD, and it costs a certain amount to people with HD. They have so many doctor visits, and sometimes they have to go and have, maybe an inpatient stay. It costs a certain amount of money, okay? And they also sometimes make a case about the societal cost. What happens to a family with Huntington's disease? How much suffering is there? How does it have an impact on not only the person who's affected, but the people around them? So they have to make a case about why it's important for that drug to be paid for, okay? And then they have to tell the government, if we give this treatment to people with Huntington's disease, how much benefit will there be? How much benefit will there be financially? Can you reduce the cost of treating HD? Can you make it so that people can stay in the workforce longer? And how much societal benefit will there be? How much will it improve things for families who have HD? So this is our Australian ecosystem. And when a drug gets ready to be approved here in Australia, we have to be able to support the case, which is how many people have HD? How are they being affected by it? How much money does it cost to have HD? Because you lose the work, eventually a person with HD doesn't have a chance to work themselves, and people around them may also lose some of their work time because they might be caring for a person. So you have to be ready to make the case to the government, to the Australian government, so that they will get this treatment approved so that we can get it out to people, okay? Now, are we in a position to do that if a treatment became approved right now? Well, we don't have all the data that we need, okay? And this is something that, has become more and more obvious to us, because as we get closer and closer to treatment being approved, we're beginning to think all the time about how are we going to get those treatments approved here in Australia as quickly as possible and get them out to people. We have got to do that, okay? So this is something that has really driven us to develop a whole new initiative. It's called the Huntington's Disease Network of Australia. And I'm going to tell you a little bit about that today. So the Huntington's Disease Network of Australia is an opportunity for people across Australia, the clinicians, the state associations, and people whose families are affected by HD to come together and to work toward how are we going to get the best quality of life and the best quality of care for every Australian who's affected by Huntington's disease. That's what this is about. Now, what do we have to do to make that happen? Well, the first thing I just was telling you, we got to know how many people have HD across Australia, how many people are at risk of getting HD, meaning that they might have the gene for HD. And to do that, what we want to do is we want to create a registry of people who have Huntington's disease in Australia, and we want to conduct a study of the prevalence. In other words, in a given region, how many people have HD, okay? That's the first part. It's called mapping HD. The second part is care improvement. Now, we know that in Australia we have some unique opportunities. We have Medicare, we have the PBS, and we have NDIS, the National Disability Insurance Scheme, which means that we can actually give additional support to people beyond what the medical system can do. This is unparalleled anywhere in the world, by the way. This is a really amazing set of things that we have. But we haven't really optimized these systems so that every person in Australia can get the best care. So people who live in more urban areas have a much easier time of getting treatment than people who live in more rural areas. And we know that we have a very big country and people are distributed all across the country. And what, in the HDNA, we believe that we have to reach every single person who's affected by HD, whether they live in some really remote place or whether they live in an urban place. We've got to make sure that those people are being cared for in the best possible way. And when treatments become available, we have to make sure that every single person, regardless of how far away they live from a medical center, needs to be able to get those treatments. We need to address this because there are disparities and unmet needs across Australia. So this is a really important thing we need to tackle. Then finally, in terms of preparing for treatments, we need to facilitate the approval by the Therapeutic Goods Administration and the pharmaceutical benefit scheme by being able to say, this is how many people have HD in Australia, this is where they live, this is the kind of treatment they're getting. We need to be able to say, this is how much the treatment costs. And so we need to be able to provide that data so that the data will support the applications to get these drugs approved quickly and to get them paid for. And we also need to make sure that we have enough doctors and other types of clinicians, psychologists and speech therapists and physical therapists and so on, all the different support workers that need to be involved to take good care of people with HD. We need to make sure there are enough of them, and we need to address all these challenges of geography so that we can make sure every single person in Australia who's affected by HD gets the treatment that they're entitled to. So out of this whole initiative, there's going to be a brand new website. It'll be available in about a week or so. It's almost ready now. It's been almost ready for a while, but it's actually going to be launched in about a week. So it's going to be the Huntington's Disease Network of Australia website. And this is how you get to, if you wanted to register for the Map-HD Registry, you'll be going to the Map-HD website. This is the front page of it. This is what it looks like. And you'll come in here and it'll take you, there's a number of ways to get to the Map-HD Registry from here. Now this has been an initiative of a committee that's been working across Australia. In fact, Jan Samuel from your very own Huntington's, Queensland has been quite involved in the development of this, and I'm happy to say we've worked really hard to get all of the state association and all of the clinics to commit to supporting this effort of getting the Map-HD Registry out to people in the community and to try and get people who want to do it to register and become volunteers on the registry. So the registry is voluntary and it's free, okay? To be on the registry, you need to provide very little information. So how it works is you've got some required information that you have to provide, and you've got some optional information. And at minimum, we would like as many people as possible to sign up and provide the required information. And if possible, we'd love for people to also provide some additional information. I'm going to just talk a little bit about what that is and give you a sense of what that is. This just shows what the sign-up page looks like. You go in, you create an account, and you set up a profile. And it's something, for some people who are not so comfortable with technology, it could be a little bit hard to do. You might need some assistance, and you can contact us, and possibly Huntington's Queensland may be able to help as well. So you can sign up through this registry website, which will be available in about a week or so. So you'll get an opportunity then to provide your name and your surname, your date of birth, and your postcode. This helps us to see where people are in Australia. Some contact details so we can contact you in the future. We want to know everyone's sex and gender, because we need to know what the distribution looks like in terms of sex and gender. We want to know, have you had a blood test for the HD gene? You don't have to tell us what the results of that was, but we just ask if you have. And we also ask, have you been diagnosed with Huntington's disease? And we give you some instructions about that, because sometimes that's not clear to people either. Then in terms of the optional information that we're collecting, we might, you can provide your CAG expansion or your CAG repeat number if you wish, but you don't have to. You can tell us about what doctors you see. I'll show you something about that in just a minute. We ask you to tell us how far did you have to travel, how long did you have to wait, because we want to know, are people able to get the services they need, very quickly? Are they having to wait a long time? And then we're asking about whether you're using NDIS or aged care services, which if you're over a certain age, then instead of using NDIS, you can use aged care services. So we're asking about both of those things. All of these things are optional. It at all, because you don't have to join the registry. Participation is voluntary and it's free, and you only do this if you wish to do it. And it's not going to be for everybody, but if you can do it, then we think that this is going to help us to work on making the case that we need to get the treatments approved and paid for and out to people. This is just a little bit more about the registry. This is a research project, and every research project has criteria who can participate. We've tried to make this to be a broad inclusion, because we are interested not only in people who have HD themselves, but we're also interested in having people who have the HD CAG expansion or the HD repeat expansion. But we're also interested in having people who are family members of a person with HD, because we know that even if you're not at risk yourself, if you're in a family that has a person with Huntington's disease, we know that you're affected as well. And we'd like to have a chance to know more about you as well. We want people who are helping to take care of a person with Huntington's disease. The other thing to mention is that it is possible, if you wanted to register, say somebody was in an aged care facility or unable to register themselves, if you have their permission and there's a certain way that this has to be done, you can register on their behalf, but only if they are indicating that they wish to be on the registry. Nobody's allowed to register someone without their knowledge. That never can happen. So this is just a consent form, and this takes you through. It's got multiple pages. Unfortunately, it is a bit long, but this tells you specifically what's going to happen if you register, and it also tells you that you can withdraw at any time, which is really important because every research project is voluntary. You can withdraw at any time, and it's very important to realize that it's a free choice. No one should coerce you into doing it or tell you that you have to do it. And I'm telling you that if somebody decides that this is not for them, that's not going to prevent us from getting treatments for Huntington's disease to Australia. It may not be for you, but it's not going to affect your ability to get treatments. The other thing I wanted to mention about this is that we also do try and link people to their state associations. All of you are linked to your state association, and that's why you're here today. But for some people who are not, maybe they come to the HDNA registry, and then we ask them, can we share your contact details with your state association, because we want to create as many strong links as we can to the state associations. Again, that's optional. Just a little bit about the data that we collect. We treat the data as highly confidential, but we do plan to share the registry data. So the whole reason to have this data is to share it. And that's to share it with the state associations, to share it with the researchers, both in Australia and internationally, and to also provide information about what's happening within the state to help the efforts of the HD state associations. But when we share that data, what's really important to know is it's shared in what's called a de-identified format. That means that no one is identified specifically. Your name's not there, your address isn't there, your number of CAG repeats is not there. Nothing that can identify you is shared. It'll just say, like, for example, it might say, that there are, 72 females between the age of 50 and 70 in Queensland in the registry. And this is the kind of thing that you do. You don't give the specific individual information about any person to anyone else. That's kept confidential in the registry. As I already mentioned, that we're going to facilitate the links to the state associations, to whichever state association people wish. And when participants agree, we'll also create some links between their data to other databases like Medicare database and PBS and Australian Institute of Health and Welfare. And that's to help us understand more about the HD community in Australia. So the informed consent for HD, the Map-HD Registry, it's important to remember, and I've said it before, I'll say it again, the participation is voluntary, but it is open to everyone who's affected. It doesn't mean you have to have HD to be a part of it. You can be, your family member has it, so that's okay. And it's what's called an opt-in consent, which means you say that you want to be enrolled. Nobody enrolls you without your, your indication that you want to be involved. And it's called a self-enrollment because people enroll themselves, okay? And that's instead, like, your doctor's not enrolling you or anything like that. You have to enroll yourself. And there, as I said before, there are those required items, which are basically the items that help us understand where you live and what, how whether you have HD or not. And then there are a lot of optional items, and you actually choose those optional items in the consent process. And you can withdraw at any time. Even if you've put all your data in there, you can withdraw it and say, I'm not putting any more data in, and furthermore, I'd like to have my data removed if you wish. So I'm almost finished now. I just want to say clinical trials really are bringing us closer to having a disease-modifying treatment for HD. And what that means is, right now there are some treatments that help with the movement disorder. There are treatments that help with the depression and the anxiety that sometimes people have with HD that's a part of the disease. Right now we don't have any treatments that actually can slow the progression or delay the onset of the disease, but we believe that we are getting closer and closer. And we, in fact, thought maybe this was going to be the year that we would discover that first treatment, because those treatments that failed early in the year were incredibly promising. But we are getting closer. You can't really get further away, I suppose. But we do think that there's such a huge amount of stuff going on, and we're honing in on something that's going to be a solution. There's not going to be one solution, by the way. It's going to continue for probably decades still. That we'll just get better and better treatments over time. We got to get the first one, and then we're going to keep looking for better and better treatments so that we can eventually make it so that people who have that HD gene are just living a fully healthy life, well, until something else unfortunately comes to get them. So that's what we're looking for. Is we want to give people who have the HD gene a chance, to not have HD. So this is just a short list of the companies that are involved. On last count, there were over 20 companies that are working actively on trying, either in the lab or getting treatments into the clinic for testing. And we know that pharmaceutical companies, they really rely on communities like ours to make these treatments testable and to make them happen. So one of the things I'm talking about with you today is kind of the idea of being involved in just supporting this idea of treatment, whether it means you volunteer or or not. Just to know that this is happening and to be a part of it, I think can really make us all feel quite hopeful about HD. And I just wanted to mention to you that one of the things we've been doing as part of the HDNA, the Huntington's Disease Network of Australia, is we're just trying really to get as many clinical trial sites across Australia as we can. We've already got 2 in Melbourne, we've got the 1 in Brisbane, we've got 1 in Perth and 1 in Sydney. We're working on some new additional sites. I'm pretty sure Adelaide might have a chance to participate in a clinical trial soon, and Tasmania and Newcastle, fingers crossed, will get them going as well, because we do want more opportunities across Australia for people to participate. So, as I said, at the beginning of this section, we are going to try and map HD. We're going to try and look at where care needs to be improved. Especially, we want to address the disparities and the unmet needs, and we want to make sure that the best care is available to every person. Given this great health system and the NDIS support that we have, we should really be able to do very well here. And this is something we have to work together to do. And we're preparing for treatments. Now, it's really important to say that one of the most important things at the Huntington's Disease Network of Australia, in fact, the most important thing I would say, is that we, I think, have stirred up the pot a little bit here in Australia, because people in Australia haven't really been banding together as much as they could have over the past years. And I can tell you, and you'll maybe hear about it soon in your own association. Your association is now working with all of the other state associations across Australia. And this is such an important development, because now, they can, they can band together to try and make have the most effective outcomes, and so that the money that gets spent on trying to provide services to people who have HD gets spent in the most efficient way. So this is a wonderful thing, and this is something that we need to keep doing. So every state still needs to have the state association. They play a really, really important role. But by working together, we think that the state associations and the clinicians and all the people who are affected by HD, by working together, we think we will be able to get those treatments to people sooner. And we want to make sure that we can get them to everybody. So we think that this is going to be the best way to level the playing field, is for everyone to work together. So you might be wondering, what can you do for Huntington's disease? Well, these are the things I can think of. Talk to anybody who will listen. I can tell you fewer people are hearing about it because I haven't been on an airplane lately, but I talk to anybody who will listen about Huntington's disease. On the airplane, to the taxi driver, to you guys, whoever will listen, that's what I'm talking about. Another thing that's really important for you to do is just to care for the people around you. So that is actually, such an important thing. If you are a person who has Huntington's disease, or if you are a person in a family that has a person with Huntington's disease, or multiple people more likely, you can do for people, to provide the care to the people around you, to provide support. These are the most important things really for a person to do before applying, participating in research, before doing anything else. Care for the people around you and support each other in little ways and in big ways. Some of you might be wanting to become a volunteer, and there are plenty of ways to do that. You can fundraise, you can help out, for example, at Huntington's Queensland. You can volunteer as a research participant. Whether you have HD or not, there's always research participation. And we usually, when we're subbing people with HD, we're always looking for people who don't have HD as a comparison. So there's something for everyone in research. You can join what's called a consumer panel. These are people from the HD community who advise researchers about, how to run the projects that we're running and about what they want and what would be helpful to them. So this is something you could do, is to join a consumer panel. Another thing you could consider is, could you sign up for the Map-HD Registry, which I've just talked about. And finally, I just wanted to mention, we are putting up this website. We've got some great photos of people from HD families there. We've got some that we have to put up there that are not people from HD families because we don't have enough photos. So if you would like to feature your family or yourself on the Huntington's Disease Network of Australia website, please share your photos with us. There'll be a link on the website to do that, but you could also mention it to people at the state association. They can provide you with some guidance. We have to have a written signed permission to use your photo. We'll take it down when you want, but if you'd like to put yourself up there or your family members, they have to sign as well. Nobody can be up there unless they've signed. We would love to have your picture, and we'd love to help foster this sense of our community across this country so that we can work together and bring the best outcomes for this disease. So with that, I'll just say thank you. I've put my email address here. I do welcome people to contact me, but I can tell you, just by working with and contacting your state association, Huntington's Queensland, I think I pretty much know all the people there. They are going to be the most important source for you of what's going on. And the HD Network of Australia will continue to work with the Queensland Association and all the associations across the country who we really rely on to help make this effort successful. So with that, I'll say thank you and stop, and I'll see if I can take a few questions.
Thank you, Julie. Is that one right? Can people hear me on this one? Excellent. I feel like Channel 7 News. Does anybody have any questions to start off with for Julie? I've got hands over here. I'm not running, I might trip over a cord.
Hi. Yeah, sure.
Just hold it right to your mouth.
Yeah, hi Julie.
A bit closer, mate.
A bit closer? Yep, g'day. Hi Jack. I was wondering, in the wider medical community, how much education is being given to the GPs or other persons that will be dealing eventually with...
Yeah.
Yeah.
Are you wondering how much training is available for,
Yes.
for doctors more broadly, just than the neurologists? Well, there is training available. Like, for example, here in Australia, we haven't made specific training available for people, for clinicians to develop skills for HD, like, for example, GPs. But GPs are really an important, they're really an important part of the care package for HD, because especially like there are only a handful, there's really less than 10 specialist HD neurologists and psychiatrists across the country, which means you got to rely on other types of other clinicians who maybe are not expert for the care. So this is something we would really like to do, is to open up broader opportunities for training, more people on Huntington's disease. And that's how we think we're going to be able to reach people in more communities, because there's not going to be a specialist neurologist in every community who can treat people with HD. There's some online training that's available through an American group called the Huntington Study Group. And this is something that what we'd like to do is identify people who'd like to have that training, and then we can plug them into some of the available training. We can also create some training here. So more needs to be done.
Yep. Yeah, thanks, Julie.
Sure thing.
Any other questions? Yep. Sorry, Julie. Oh, I'll get there.
One of those trials or treatments, you said the participants have to not only have HD but another, I think you said, genetic condition, and I was just wondering what that was.
Yeah, it's not really a genetic condition. It's just On the chromosomes, we've all got the chromosomes, and all of our chromosomes code for all of these different characteristics, like our eye color and our hair color and so on. And when I was talking about those, there were those 2 wave trials that failed, and then we've got this new one coming up. So that one's the one that has a special condition. So in the first 2 wave trials, there was also a special condition. It was called, what people had to do is they had to have their blood tested. And then that blood test had to determine whether they had something called the SNP1 or the SNP2. And now this is going to be the SNP3, okay? What that means is that, like, how we're talking about in the HD gene, you have a whole series of CAGs. That's what the CAG repeat is, or the CAG expansion. Everybody's got these CAGs, whether you have HD or not. Everybody's got, there's this kind of string of CAG, 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 CAG. And SNP1 and SNP2 and SNP3, well, the way that works is that it's actually not exactly true that you go CAG, CAG. There's the CAGs, but they're interrupted by little other messages. And in this case, the messages are called SNP1 or SNP2 or SNP3. So this is looking for people who have a particular type of interruption in their CAGs to see, because the way these treatments work is they go in and they they bind to the CAG expansion in a way to try and prevent the production of the protein that comes from it. And they do that by linking onto one of these specialized SNPs, okay? There'll be more SNPs coming down the line. So, not every person is going to have SNP1 or SNP2 or SNP3, but maybe you'll have SNP4. Some people have SNP1 and SNP3. And so when you're going to get into one of these kind of specialized trials, they're going to check and see what SNP you got. Okay, and it doesn't confer anything like your hair color or your eye color or anything. It's like a little tiny variation in messages. We all have a whole bunch of these variations, and those are just the variations they're working with.
Thanks. Can I just ask one more? Are they looking at other ways of delivering drugs other than intrathecal?
Absolutely, yes. So so intrathecal are the ones that are going into the spinal fluid. They do that through a lumbar puncture. So that's, there's also the brain, going directly into the brain. Now they're also looking at some that can go into the bloodstream, or like, so there are.
Sorry, Julie, you're breaking up a little bit there. That's the timer telling us we're out of time.
Doing over any country. So we've got to, first we're going to have to find a treatment that's going to work, and maybe then after that they're also working on what are called delivery systems, which are ways of like sort of packaging up a treatment and either having it going in by mouth or by the bloodstream to get into the brain. So that's another whole interesting topic that is very lively.
Thank you, Julie. We did miss a little bit of that because it froze for a second, but I think we got the end bit, and that made sense to me. So, any other questions before we wrap up? We really only got another minute, but that's okay. Look, can we have another big round of applause for Julie Stout? We're really grateful that you gave up your time for us today, and we're all crossing our fingers and toes that you'll be here in person next year. Okay.
I love that. Thanks. Take care.
Thank you, Julie.